Dr. Idee Charles. Welcome to the Health Gospel YouTube channel where we talk about our health. And today's topic is top reasons why my diabetes must be under control. Top reasons why my diabetes must be under control. It's very important topic, especially for us Afro-Caribbeans, Asians. It's very important that we know the reason when your doctor say, please take your medication, please your blood sugar, I need it to be under control. I need you to be under control. You might be wondering, what is it? Is it your disease? Is it your sickness? Is it your diabetes? These are things that people say, what is it? Why are you disturbing me? Is it your diabetes? Is it not me living with this diabetes? And some people, when they have, okay, I'm on. Some people, when they have diabetes, that stage of denial, that stage where they are living in denial, is a very bad stage because at that point they are, one second, I'm going to come back. I'm just trying to see where we are. So I'm going to come back. So when they're diagnosed with diabetes, they have they live in denial. So they live in denial. They might live in denial for a year, 2 years. And this period, this is why it's very important. This period, they are causing a lot of problem for themselves. So when they are diagnosed with diabetes, especially our African religious people, they start to bind the diabetes, they start to go to churches, they start to fast. It cannot be my portion. Why should it be me? What have I done? Who did I offend? My enemies are after me. And all these accusations and living in denial and binding, this period is causing a lot of problems for themselves. Some people, when they are diagnosed with diabetes, instead of them to say, please, doctor, what is really this diabetes? How can I help myself? They will just look at the doctor, walk away, they give them medication, they take it as if they are taking antibiotics. They take it today, they don't take it tomorrow. And when the doctor goes and says, look, you are not taking your medication. Doctor, I thought it's just for 7 days. They took it for 7 days. They are not taking it again. These are the people that we see with diabetes. They do not understand the reason and the need why their diabetes should be under control. And this is why we are doing this topic today. I want to break down why you and me, all of us who are diabetic, who are at risk of diabetes, should make sure that our diabetes is under control. We need to make sure that it's under control. And this is the reason why I'm doing this video. So let's go. Diabetes, we have 422 million people living with diabetes. You see, you are not alone. You are not alone. Stop saying, God, why me? 422 million of you are living with diabetes. So don't say, why me? God, why me? Who did I offend? What did I do wrong? No, you are not alone. 422 million people are living with diabetes. So we have another group of people who are type 1 and we have type 2. Then in a whole year, we have people, 1.6 million people dying of diabetes complications. 1.2 million people dying of diabetes complications. Why? And most of these people are from low and medium income countries. Most of these people are from countries like Africa, Asians. We are the ones dying of diabetes complications. Why? Why? I think because people do not understand the condition. People do not understand the need to make sure that the diabetes is under control. People do not understand the need to make sure that their blood sugar is under control. So we have two major types of diabetes, type 1 diabetes and type 2 diabetes. So with type 1 diabetes, you cannot produce insulin. Your body cannot produce insulin. Insulin is produced by an organ in the body called pancreas. There are cells in the pancreas called islet cells of Langerhans. They produce insulin. And insulin is a big, big, big player when it comes to diabetes and blood sugar. Insulin is a hormone that goes into the system that mops out sugar from the blood and pushes it into the cell. So insulin is the key that opens the door for sugar to get into the cells, into your muscles, your brain, your heart, your kidneys, because the organs need energy in terms of ATP. The organs need energy. So energy is the energy is the glucose that we eat, and we break down food and we have glucose, and that is stored in the cells as energy. So when we eat, we produce glucose. It's stored in the cells as energy. And the major hormone that does this job is insulin. Goes into the blood, pushes this glucose into the cells to help us, because the cells need energy. The eyes need to see, the brain needs to function, the kidneys, the heart. So we need energy. So, but in people living with diabetes, type 1, they cannot produce insulin. So their sugar level is high in the blood. They have high sugar levels in the blood, not in the cells. The cells are hungry. The cells do not have energy because nothing is helping. That key that opens the door is not there. So in type 1 diabetes, the symptoms come on very quickly. These people have symptoms of polydipsia, polyphagia, the 4 P's. So it's polydipsia, polyphagia, polyuria, and polyuria, polydipsia, polyphagia, and we have paresthesia. People they just start feeling numb. They start feeling numbness everywhere. So they feel thirsty, they drink a lot, polydipsia, they pee a lot, polyuria, polyphagia, they eat a lot because they are hungry. The cells are hungry, but the sugar that is supposed to be in the cell is still circulating in the blood. There is no insulin to push the sugar into the cell. That's type 1. In type 2, which majority of people have, people call it lifestyle diabetes, people call it preventable diabetes, but it is one of the very common types of diabetes around. And the risk factor is where we come from, Africans, Caribbeans, Asians. We are at risk of type 2 diabetes. This group of people. If your family member had diabetes, you are at risk of having type 2 diabetes. Your age, if you're above 40, you're at risk of having type 2 diabetes. You're obese, you're on the big side, you're high BMI, you are at risk of having type 2 diabetes. It can happen. Now with type 2 diabetes, the insulin is there, but it's not working. So you have a bad key. The key is there, but it's not the key is not working. Sometimes you put it works, it opens the door a little. Sometimes it just doesn't work. So they have insulin, and our body we have insulin resistant. The insulin in the body cannot work. It's not working, and the risk factors are there. What we call obesity, people who smoke, family history, where I come from, my age, all these things. Over time, my body develops insulin resistance. The action of insulin is not there. So the body is not getting that insulin that pushes the glucose into the cells. So we have accumulation of sugar in the blood, not in the cells. These are two different things, because people will say, but this sugar, they say I have high sugar. Don't I need sugar? You need sugar in your cells. You don't need high sugar floating in your blood. That's the difference. Because when they take that blood and they test it, the sugar is high in the blood. If it is in the cell, nobody would test and see high sugar in the blood, because it has been mopped into the cells. So it is in the cells doing its job, providing you with energy. Your eyes, all the blood you need, is helping you to think, to walk out, to use your muscles. That is what glucose is meant for. But in people with diabetes, this glucose is in the blood. There is no key to push it into the cells. You see what we're dealing with? We're dealing with a condition where we cannot push our sugar into the cell, whether type 1 or type 2 diabetes. What now happens? So the sugar remains in the blood, and the blood is carried by blood vessels. We have blood vessels is like a pipe. Let's look at a pipe that carries water. So we have a pipe that carries blood. So because there is a high sugar concentration in this blood, within this pipe, what happens to the inner part of this pipe? There is a lot of process that goes on inside this pipe because of that high sugar level. There's a lot of changes, inflammations that happen in the inner layer of this pipe, which is your blood vessel, and it begins to weaken it. It begins to cause a lot of problems. And that is the origin of diabetes complications. That is the origin of diabetes complication, because there is a lot of sugar floating in the blood vessel. The innermost part of your blood vessel begins to have changes, inflammations, complex changes. It weakens the inner part of the blood vessels. When it weakens it, that is the origin of all the complications you have with diabetes. So you have microvessel complication and macrovessel complication. What does this mean? Big vessel complication and tiny vessel complication. We have tiny vessel complication with the eyes. So the blood vessels that supply the eyes are tiny blood vessels. They are not big blood vessels, they are tiny blood vessels. The same with the kidney. So because they are tiny blood vessels, these are the early changes that will happen. So somebody with type 2 diabetes who doesn't even know I have type 2 diabetes, because some people go up to 10 years, it is recorded, it is known, without knowing that they have type 2 diabetes. But within these 10 years, so many changes have happened with the organs because of that constant blood sugar, which is high in the blood. So the tiny blood vessels are the ones early affected, and they are the ones that supply your eyes and your kidney. They are the ones that supply the tiny vessels down your legs. So you have early changes with your eye, which is called diabetic retinopathy, problems with the back of your eye. You have people with diabetes who are having glaucoma, increased pressures in the eye, cataract, which is like a white coverage that covers the lens. The lens is like your lens, your glasses. Your lens is the part of the eye that helps you to see clearly. So when it becomes clouded, that's cataract. A lot of people with type 2 diabetes have cataract. They have glaucoma. They have diabetic retinopathy, which comes on very early, one of the earliest complications of diabetes. Number 2 is the kidney. What is the function of the kidney? The kidney helps to filter all the poisons, the toxins. So we eat food, we drink alcohol or juice, all those things we drink, we rub cream on our bodies, we don't know what poisons they contain or what toxins we have taken in. The kidney is there to filter all these toxins and poisons off your system, and you pee, you urinate it out, it comes out as urine. So now with the kidney, because of the tiny vessels being weakened and being destroyed with high blood sugar, which is in the blood vessel, the kidneys, the filter itself begins to be weakened and it starts to leak. So the filter is no more tight, is no more complete functioning, it is weak because of the high blood sugar, because the tiny vessels that supply this filter is already weakened. So some of them are not functioning properly. Blood is not being supplied to the filter properly because the vessels are dysfunctional. So what happens is the filter begins to be weakened, and they start to leak things they shouldn't leak. They shouldn't leak protein, they start to leak it. Then they leak protein, that is what they call a leaking kidney, which is a kidney disease. So the kidney is diseased. When the kidney, which is supposed to filter only poisons, toxins, begin to let go of proteins, so it is weakened. The system is weakened. So that is where we start to have diabetic nephropathy, kidney complications of diabetes. Now we have the tiny vessels in the legs. So we begin to have problems with the legs. We begin to have problems, numbness, we can feel it, and all this sort of problems. So these are problems that you just overlook because probably nobody has diagnosed you with diabetes, especially type 2. So you go all along and you are having this problem and it becomes progressive. So the basic, the root cause of complications of diabetes is the persistence of a high blood sugar in the blood vessel, which causes a lot of changes within the blood vessel, the walls of the blood vessels, which lead to complications. The big vessel complications are things that affect the bigger vessels in the body that supplies the brain, the heart, that supplies the big arteries down the legs. We also have problems with digestion, erectile dysfunctions. These are diabetic complications. With a lot of people will have erectile dysfunction. They have problem with constipation. They have problem with diarrhea. These are autonomic problems, problems that come with diabetes, poorly controlled diabetes. With the heart is supplied by coronary arteries. These are big vessels that supply the heart. And within these big vessels, remember, we have this high blood sugar in the system. So there is changes, there is inflammation, there is plugging, atherosclerosis. We have this atheromaplex that covers the inner part of the blood vessel, and they block it off. They sort of close it. When it's completely blocked off, there's a plug of the, if you think about it as a pipe, and this pipe is clogged off, slowly the pressure that goes out of the pipe is very little. You'll be asking, something has blocked this pipe. That is the same with the heart. The day that blockage becomes complete, there will be no more blood supply to that part of the heart. So you have a heart attack. That's basically what a heart attack is. When there is a blockage of the artery that supply a part of the heart, you have a heart attack because that part of the heart muscles begin to die off. So that's the major complications of diabetes. Then we go into the brain, the vessels, the blood vessels, the big vessels. They are weakened. They can break off, burst. They burst, you bleed in the brain, you have a stroke, hemorrhage in the brain. You have memory problems because of constant, persistent lack of blood supply to the brain. The brain cells begin to die off. You have memory problems, which becomes worsened as you get old. So these are irreversible problems. You can't reverse them. But the good news is, with a tight diabetes control, these complications can be managed and they will not progress. If you're diabetic, this is very important information for you, that this is the reason why your doctor says, please take your medication. This is the reason why your doctor says, please take your insulin. This is the reason why your doctor is begging you, please, I need you to go and check your eyes. Because if the complications are identified early, there can be a stop to the progression There's things that can be done. So if you're diabetic, you need to be having yearly eye check. If you're diabetic, you need to be having yearly kidney check, at least kidney functions, to make sure that your kidneys are okay. If you're diabetic, you need to be wary of all these complications. You need to be conscious of them. So what you need to do is control your blood sugar level. They give you medication, take it. They give you insulin, your life depends on it. You need to be serious with it. Now let's move on to, I've discussed the complications and why we need to have a top control on our blood sugar, on our diabetes. So prevention. If I am at risk of having type 2 diabetes, I need to prevent it because it's a chronic condition. It has so many complications from head to toe. My brain, my eyes, my mouth, I can have ulcers, fungal infections, my heart, I'm at risk of heart attack, heart failure, I go to my abdomen, I'm at risk of having constipation, diarrhea, I can start having urinary problems, erectile dysfunction, I have sexual dysfunction. A lot of women have sexual dysfunction. They just cannot have orgasm. They don't feel it because of the poor control of diabetes. Men have erectile dysfunction. They do not have erection. It is a big problem. So you come down to the legs, the big arteries down the legs, they get problems. So you have things like ulcerations, people climb on glass or have a break on their leg, a wound, they don't even know. And this wound will not heal. It doesn't heal because the blood is filled with sugar and bacteria feed on this sugar. Circulation down the leg is poor. So even when you give these people antibiotics, it doesn't get to the target area. So they do not heal. They don't heal because the sugar is high, the circulation is poor. So these two combinations, they don't heal their wounds. And this wound remains in most parts of the culture of Nigeria. They have names for these chronic wounds. They call it different things. You need to go to the babalawo and get concoction. These are diabetic ulcers. And if care is not taken, you are going to have amputation because that leg is going to die off. A lot of diabetic patients have amputations because when the wound started, they didn't aggressively treat it. They were praying it out. They were pouring olive oil on it. They are pouring Papa's mantle on it. They collected Papa's label or flyer or sticker and be putting on the leg to heal. All this time, the wound is getting worse. At the end of the day, you are going to have amputation either of your toe, of your whole foot, or even down from your knee down. And combine that with kidney failure or heart attack, how are you going to survive? That is why 1.6 million people are dying every year from diabetes complications. And most of these people are from low or medium income countries like Africa. We need to know why we need to control our diabetes. You don't have to listen to everything you hear. You need to take this. If you know you are taking everything you want to take and your sugar level is not controlled, you need to stop. Anything you are taking that is not controlling your blood sugar, please, my dear, you need to stop. Get to the doctor and get proper medication. Because if you have all this complication, you don't have money, there is no free medical care where you are, you're gonna die. You will die. What is the best thing for me? The best thing for me is, if they've given me medication, let me concentrate and take my medication and leave. Pastor, you can pray for me. It's okay, but I will take my medication. If God is healing me, I will know because the sugar will be low. If they take my blood sugar level, it will be normal. I can't be a blood sugar level of 20 and you say God has healed me. You are living a lie. You have to be real. You have to be real. So we look at all those things, and I think that people need to know why their blood sugar has to be controlled. So how do I prevent myself? We have risk factors. So you look at the risk factors, which one suits you? Are you obese? Do you have a family history? Are you age over 40? Are you from Afro-Caribbean? If you tick all these boxes, hey, you are at risk. At risk. So what can I do? I can't change where I come from. That's nothing I can change. I can't change my sex. That's nothing I can change. I cannot change my age. That's nothing I can change. So I can change my weight. I can work on my weight. I can exercise. If I used to smoke, I can stop smoking. So these are things I can change. So I can change my lifestyle. I can aim to lose weight. And it has been documented by studies that if you lose a significant amount of weight, if you were pre-diabetic, you're completely not diabetic at all. You are not pre-diabetic. You will go back to your normal state if you lose some weight. If you exercise, your exercise is not just losing weight, you are actually helping your insulin, you're getting it more sensitive, you're exposing it more to act better when you exercise. You begin to lose weight. If your cholesterol is high and you're doing lifestyle changes, you're eating well, you begin to bring down your cholesterol level, you are bringing down your cholesterol level at the same time making your insulin to work better. So with the insulin working better, with that key working better, it opens the doors, the blood sugar gets into the cell, we are home and dry. But if we leave things and just, it's okay, why me? I want to know who is doing this to me. And you spend a year, 2 years looking for who caused you to have diabetes, you are causing yourself more problems. So today we have learned that our diabetes needs to be under control, top notch, so that we can prevent complications. We have learned that there is complications from head to toe. Every part of our body is affected by diabetes. And this is because the sugar level in the bloodstream affects the vessels that carry this blood. So the answer to our problem is good diabetic control. And I do hope that if you listen to me, you will go back and think again, look at your risk factors. If you're already living with diabetes, make up your mind to have good control of diabetes. And before I go, I talk about a little bit about diet. People say diabetic diet. Oh, I have this diabetic diet. This is for diabetes only. Nothing like that. You need to have a balanced diet. A balanced diet, not high carbs diet, only protein diet, only vegetable diet. You need to balance because your body needs vitamins, needs proteins, needs more vegetables, need fruits. They recommend 5 a day, 5 different pieces of fruits a day. They recommend that in your plate of food, you should have raw veggies, you should have fruits, you should have vegetables. They recommend all that. But if you're diabetic, keep your carbohydrate low carbs diet, but make it balanced. That is the ultimate. Low carbs diet, but make it balanced. That's the ultimate. Make your diet balanced. Don't eat only one type of food. You are causing yourself problems. And I'm just going to mention quickly complications. You know, people with type 2 diabetes, because some people leave the sugar to be so high in the blood. You know, when you melt sugar, you see how thick the sugar, the concentration is. So it mops out the little water you have in your system, mops it just to help the blood is sluggish, the sugar is so high. It mops out all the fluid. So what does your cells do? It goes into dehydration. The cells are so dry. So you go into hyperosmolar state. These people die a lot in Africa because when they get into the hospital, they say, oh, sugar is 50. Blood sugar is 50. They start giving them insulin. What they need is fluid. If you give them fluid, it will go in because they are so dehydrated. And there is a regulation. I'm not going to go into those today. If you're type 1 diabetes, you leave your sugar so high, you will go into a state called ketoacidosis. You produce poisons which will probably kill you. Diabetes on its own. So, my dears, the best thing for me and you, the best thing you can do is control your diabetes. They give you medication, take it. If they give you insulin, take it. If somebody is telling you, I'll pray for you for your diabetes to be healed, that is okay. Check the sugar. Check the sugar level. If it is not low, you are not healed. Go and take your medication. These people, some of them will lie to you. If somebody says, I can heal you of your diabetes, it's okay. Go and prove it by pricking your finger and checking the sugar level. If it is still high, please go and grab your medication and start taking it. I know that if we do this, we take control of our diabetes, we will have less and less complications and less numbers of people dying from diabetes. Thank you so much, everybody. Subscribe to this channel, like the videos, and click on notifications so that you can get videos as we publish them. Thank you so much and stay blessed. I am Dr. Idee Charles, always here to give us health tips on how to live healthy and longer.